Okay, so now we're going to do a PRK, and you can see I'm putting a ring or a well on the eye. I'm injecting a little bit of alcohol. It's not in the eye, it's on top of the eye. You can see that. And it's held on by this ring. Now, the guy's closing his eyes, so his eye's moving up a little bit. You kind of don't want to do that during the procedure as the patient, because then the alcohol leaks a little bit. It might sting. You could say use the Wexel or a cellulose sponge to soak up the alcohol, and now I'm putting on some BSS to rinse it off, so if it leaks, it doesn't hurt. So now basically, you can see there's no suction ring like in a Lasek or in a epi-Lasek. There's no need for that because this is a manual removal of the skin of the eye. Different than a Lasek, and you're going to see it's different because in this case, the surgeon's really not going to get a great dissection of the epithelium, okay? Now, there are different reasons for that. I guess the guy moved his eye a little bit, and also it's just not really coming out in one piece, okay? So just, if you think about this from a microscopic point of view, these cells are dying right now, combination of alcohol, which is toxic to the epithelium or skin of the eye, and some trauma, because you can see there's some mechanical stuff going on where we're scraping away the skin of the eye. So basically what's caused the inflammation and potentially pain and scarring on a PRK, which is what we're watching here, is basically that the epithelial dissection or removal from the cornea surface, which is underlying it, and what we want to get to with the laser, is just not really that clean or atraumatic. So, in the end, everything's going to be fine. You're going to have a clean surface. You're going to take off the skin of the eye, but it's really the methodology of skin removal. If you take off the skin really, really cleanly, which is with a machine, which we call epi-Lasek or epi-Lasik, there's no pain, inflammation, or scarring. The next best way is doing it with the alcohol, but doing it like really cleanly. There'll be another episode of that, and I'll show you where that's also pretty atraumatic. Not quite as atraumatic as with the machine, but still pretty good. This is basically a PRK because they're going to call this maybe an alcohol-assisted PRK, which is using the alcohol to delaminate the epithelium. But it's really, it's basically winding up a PRK. There's another way to do a PRK too, and we'll show a little video of that, a clip from the internet. I used to use a moiless brush with a little bristle brush and nylon. It's like an electric toothbrush. I don't use it anymore, so we're going to have to pull that video from the internet and narrate it. But that's another way of doing a PRK with the manual removal without the alcohol. This technique of alcohol removal was invented at Harvard when I was at Harvard with two of my colleagues, Juan Carlos Abad and Jonathan Talamo. They're both MDs, and we published a paper about that. This is like 1997 or something like that. And this is just basically the laser going off. So I just want to reiterate to the consumer and viewer that the laser part's the same of all these things. So when you're talking about all these different procedures, we're really not talking about the laser part. We're talking about the different methods of epithelial removal on the surface ablations, which are PRK, Lasek, and epi-Lasek, or how to cut the flap, which is basically Lasik, or a bladeless Lasik, which is basically a little bit of a misnomer. It's really cutting the cornea and making a flap with a laser. It's still cutting, it's just bladeless because it's not a metal blade. And you can see the thing is, again, quick, and we're done with the laser part. The guy's now, again, trying to close his eyes and decentering, but it really doesn't matter because the laser's done, okay, and the procedure's done.